The signs, the commonest signs are there. I think one of the commonest signs is withdrawal. The person involved withdraws from normal activities that they usually enjoy. If it's in terms of maybe socializing, going for social functions, or just socializing at work, at religious places, you find out that they stop doing such things or they cut down drastically and eventually isolate themselves. Restlessness is another sign. And when we say restlessness, they are edgy, their minds are not settled. Tenseness of the muscles. If you're close to them and you see them, either facial muscles look tensed up, grimace, the limbs are as if they are ready to jump. You have lack of sleep, or on the other hand, too much of sleep. Anxiety, in terms of, now, it's okay for somebody to be anxious every now and then, but there are times when it becomes, how I put it now, attaching too much anxiety to a situation, become overly anxious. Then the other ones also are when they start saying, oh, they are hearing voices, they're having hallucinations, or they are having sensations, crawling sensations, they are seeing things that other people around there are not seeing. Those are warning signs. We also have some other scenarios where people who normally don't drink habitually start taking more alcohol, substances to alter their moods, smoke, now start taking more cigarettes for the nicotine effect. Also, easily getting tired. They complain of fatigue. Any little effort, they're tired. They don't want to do anything, or they don't want to exert themselves. If you try to push them, it's like they easily give up. Those are what they call it, warning signs of failing mental health. In Nigeria today, we don't need to look far. The risk factors to mental health are all around us. Every day that we wake up and we get into the roads and we experience hold-ups, traffic jams, those are risk factors to health. What we can do, so to speak, in terms of mitigating, coping with those risk factors are numerous. One, meditation. Meditation is in terms of consciously not thinking too much. We didn't say don't think at all. Don't think too much. Don't dwell too much. Don't criticize too much. But so many things around us are therapeutical. Apart from meditating on what do you call it now, on the positives. We look around us and we think of all the positive things. Is it in terms of relationships? If there are thoughts from listening to scripture, if there are thoughts from listening to good, inspiring, edifying music, there are things, that we look around us and they have a calming effect on us. So nothing stops us from engaging in wholesome conversations with people around us and thinking of the positives. So those are some of the coping mechanisms. And also, we say taking deep breaths. We have, research to back up that when we have controlled breathing in stressful situations every day, we're able to cope more. Maybe because of the extra oxygen intake, because of the conscious efforts not to think of the stress around us. So those are things that we can do every day. They don't cost much money. They only cost us concentration and focus.